tell us about testosterone and heart attacks then. Does testosterone cause heart attacks?
Yes and no. Okay, so not to confuse you, testosterone and nandrolone, which are the two easily identifiable anabolic steroids in the human body. So the male human testicle makes testosterone for the most part, like 99.9%, and then a 0.1% nandrolone. And both of these have strong anabolic and androgenic effects. Nandrolone has 10 times the anabolic effect of testosterone and 10 times less the androgenic effect. However, nandrolone has 10 times the cardiotoxic effect of testosterone. So what is this cardiotoxicity? What does that mean? Well, apparently the androgen receptor interacts with the mTOR system in the cardiac myocyte, and that interaction with time is more promoting growth and proliferation, and as a result of that, some of the cardiomyocyte might start remodeling. And whenever you remodel a muscle, it's just never the same, which doesn't really matter if you're remodeling your biceps. You just want strength from your biceps and size. You don't care about the remodeling process of the fibers of the muscle. But when it comes to your heart, you don't want anything remodeled. When you remodel stuff, the heart is not going to pump the right way. And whenever the heart doesn't pump the right way, it becomes prone to things like ventricular fibrillation. So a lot of times, cardiotoxicity is not a heart attack. It is actually an abnormal, rhythm, specifically VFib. So a lot of these young men who they're saying that they're dying of massive heart attacks, and a lot of them are, but a lot of them also are dying from VFib. Now, who's getting those? Okay, so who's getting the VFib and who's getting the heart attacks? So I told you about the VFib mechanism. As far as the heart attack mechanism, so that one is strictly related to the degree of polycythemia and also the thrombotic potential with anabolic steroids. Now you're thinking, like, wait a second. So are you telling me that testosterone is, in addition to giving you polycythemia, it's making our red blood cells sticky? That sucks. Okay. Well, it does at a certain dose.
Right.
So, for example, if you're giving the patient 100 milligrams a week or up to even 600 milligrams a week, you see how big of a window you have? 100, 200, 300, 100 to 600 milligrams a week. You're good. You're good there, okay? There is no thrombophilia in this situation. You're going to have to look at the polycythemia in the labs. The polycythemia is tricky. Some men, I swear, you give them a fuck ton of testosterone, their blood cells do not budge.
Yeah.
Then some men, you give them a teeny tiny bit, and the polycythemia is out of control. So with the polycythemia, not always dose predictable. You actually have to test them. So that's that. But with the thrombophilic effect, we're talking about higher doses. We're talking 800 milligrams a week. So those guys who are falling like flies from massive heart attacks are taking 800 a week or more. Now you're thinking, well, who the fuck takes 800 milligrams a week of testosterone? I mean, how do you even put all that volume in? So those are guys who are going to take, cattle anabolic steroids. They'll do Tren, they'll do Sustanon, they'll do Deca, and they'll do Test, and then they do a little bit of each. And then the funny thing about them is that when you talk to those guys, they give you the milligrams separately. They don't understand that it's all anabolic and you're supposed to add all the milligrams. And that's how you know how much push you're putting on your body. And almost always 800 is actually the lower end they go for. I mean, the doses out there in New York City and Atlanta and LA are just phenomenal. You don't understand how these guys are walking. They're just walking, waiting to explode. So these doses are the ones that cause a polycythemia so extreme that it becomes that it causes a clot. And now you have, in addition to the polycythemia, the actual thrombophilic effect of the anabolic steroids. They make your blood vessels and platelets very sticky. So that's how you get the massive heart attack. And those guys love the look. They like the ruddy look. They like the extreme vascular look. And when you take them aside and have a conversation with them, they'll be honest with you. They'll tell you, you know what, dude, I don't care if I die at 55. I'm cool with that. It's like that's their philosophy. So
and I'm all for liberty. If that, if they want to make the choice, that's fine.
Exactly. You want to be a martyr? That's fine. Yeah.
Right. But let's talk honestly about it. I mean, my personal opinion is I don't think it's healthy.
No, it's not.
And I mean, even when you look at, typically what you're talking about is the body, the competitive,
right.
At a national level bodybuilder is what you're talking about. And those guys aren't healthy. I mean, they might think they look good. And I suppose that a lot of men, we compare ourselves to them, but they're not healthy by any means.
No, I completely agree.
And in my opinion, as a pharmacist that specializes in hormone replacement, all the stuff they're taking, it is like you say, I don't know how they live. I mean, I don't know how they stay alive.
They have good genes.
I know. I mean, I've seen some of their, or heard about, I mean, they're not my patients, but some of the doses of, because they take insulin, of course.
Yeah, I know. That is a whole...
20, I mean, for a non-diabetic, they're taking 25 to 50 units of insulin per meal. It's like, holy crap.
Right.
Are you serious? How do you live?
Right.
And so anyway, my personal opinion is that when it comes to hormone replacement in general, and there's, other opinions out there, really as a man, you need testosterone and DHEA. Those are the two main hormones you need to stay healthy. And that's the hormones that we produce in our body ourselves anyway. We just don't produce as much as we get older.
Right.
And one thing I like to remind people about is if we dose people in a dose that is healthy, and we just try to get them back to, to be in their 20s or 30s, and we get to try to get them back to that level. If we think about that, 20-year-old and 30-year-old men, or let's just say this, a 19-year-old man is usually, our testosterone is the highest when we're 19, or so, right? When we're in our young 20s or late teens, our testosterone is really high.
Yes.
And men don't have heart attacks when they're 19 in general. So testosterone does not cause heart attacks.
Or prostate cancer, for that matter. Yeah.
I was going to say, that's our next right. That's our next topic. Testosterone and prostate cancer, same thing.
Right.
If testosterone caused prostate cancer, 19-year-old men would be getting prostate cancer. Their testosterone are high. Yeah. So it is a dosing issue for sure, and other substances. So, you can't compare when you say steroid or even anabolic steroid, that's a very broad term.
Right.
Broad term. So, we have to really get into the details of it and at what dose.
Exactly.
Are these people taking? So
exactly. And all these a lot of people who are very professionals, who are celebrities, and they're big and jacked and everything. A lot of them are still on black market anabolic steroids, even though they're jacked and they have the resources. But because their doctor is probably not going to prescribe 800 milligrams of testosterone to them, because the doctor can't get away with it even if they want to. So they're also getting their shit from the black market, which is, of course, usually either having impurities or it's cattle anabolic steroids that have maybe a much higher anabolic profile because we want our cattle to be huge, but not the same cardiovascular safety profile. So,
right. And then there again, that's why it's important to go to a doctor that knows these things and not from your buddy in the gym that's handed out stuff.
Right.
That's something to stay away from.